Okay, as you can see today we are going to talk about names of instruments and their uses. Just look at how it is being arranged here. We are going to talk about it one after the other. And you can see the first instrument you are going to identify is what is called Chitu forceps. Look at is what is called Chitu forceps. Chitu forceps is an instrument used to pick instruments. It is used to take sterile instruments. Like example, look at what I want to do. Like let me say I want to take this scissors. I'll just do like this. My hand will not touch it because it is already a sterile field. I'll just take the instrument. Then I'm done with my glove. I'll then take it and use. So that is the function of this pocket. It is used to take sterile instruments. Okay. The next one is scissors. As you can see, we have different types of scissors here. We have two surgical scissors. This is straight surgical scissors. This is curved surgical scissors. As you can see, what you use to identify surgical scissors is that both the two mouths are equal. As you can see, the two mouths are equal. The two mouths are equal. So the uses of this surgical scissors is it is used to do operation. It is used to give incision both in the abdomen or any place you want to operate on. You make use of these surgical scissors. Now, look at what is called cutting scissors. It is called cutting scissors. As you can see, the mouths are not equal. Cutting scissors is used to cut sutures. It's also used to cut gauze and anything that you want to make use of it, like cutting. You can use it to cut the tissues of the abdomen, any tissues. You can use cutting scissors. So this one is circumcision scissors. It is used for circumcision. You know what circumcision is all about now. So it is used for circumcision. So this one is called episiotomy scissors. Episiotomy scissors is used in labor. It is used to give tear or to make a space during normal labor or vaginal labor. So it is being used when the head of the baby is too long or too large, too big, or when the baby himself is too big. So we use it to give tear at the part of vagina called labia minora. That is the place you can use the scissors to cut. It is used to give tear in the vagina. So that's all about scissors. The next instrument we are going to talk about is artery forceps. We have different types of artery forceps. This is what is called long artery forceps, but this one is curved long artery forceps. This one is straight long artery forceps. This one is medium curved artery forceps. This one is medium straight artery forceps. We still have small artery forceps, but it's not here now. So all the artery forceps is being used to catch bleeding. Is used to stop bleeding during any procedure or during any operation. You can also use it to remove dead tissues. You can also use it for dressing. So that's all about artery forceps. So now, this one is called needle holder. As you can see, that the teeth is not long as artery forceps. It is used to hold the suture. It's used for suturing during operation. So now look at these ones that you are seeing here. We will be talking about it one after the other. Look at this one. So you know this one? Okay. This one is called, just look at it. You can see it. This is the instrument we want to describe. Do you see it very well? It's called sponge holding forceps. So look at the uses. We use it to take gauze. When it is like this, it's already called swab on stick. Use it to hold gauze for cleaning the abdomen or the area that you want to operate on. So now, this one is called green hermitage. This is green hermitage. Green hermitage is used to hold bleeding, uterine bleeding, during cesarean section. So we use it to hold tissues, bleeding that is coming from tissues. But note that the main function is that it is used to hold bleeding that is coming from the uterus during cesarean section. So now this one is needle holder. Blade holder. This is blade holder. This is where you will fix your blade that you want to make use of it. You fix your blade for incision. This one is called towel clip. Towel clip or abdominal clip. It is used to hold the abdomen, abdominal cover during any procedure. And as well, you can also use it to remove some myomas. During myomectomies, you can use it to remove fibroid, that is myomas. So now, this is called laryngeal retractor, just as its name implies, laryngeal retractor. It is used to retract, to make space, so that you can see clear where you are operating on. This one is manual actually. So this one is what is called self-retaining retractor. This is self-retaining retractor. The reason why we call it self-retaining retractor is that it retains itself. What you have to do is when you want to see space or when you want to make space, what are you going to do? Is being used. Self-retaining retractor. If you want to make use of it, you put it into that place you want to make use of it and do like this. So the thing will give space, you leave it like that, it will stay on itself till when you finish anything you want to do, then you can remove it out. It retains itself in the sense that when you put it to the area that you want to make space, you clip it and the thing will stay like that. Then if you want to remove it, okay, look at this, look at what I'm saying. So that is it. It's self-retaining. It retains itself. We call it self-retaining retractor. Okay, this is what is called Cusco speculum. Just look at it. It's a vaginal speculum that we use to do examination in the vagina. Look at how it is being used. Let me say that when you want to insert it now, so it is being used to make space in the vagina. When you want to carry any procedure in the vagina, so you use this thing to insert inside the vagina so that you can see clear very well and know what you want to do. Or you can see very well what you want to do. Look at how it is being used. See, when you open it like you tie it here, the thing will stay like that. You will be seeing everything that you want to do. So now when you finish everything you want to do, you can remove it. Just look at. The thing will close, then you bring it out. Do you understand? It's okay. So now look at this one. So this one look like spoon, but it's not spoon. It's a medical instrument known as bladder retractor. This is used to retract the bladder during abdominal operation. It is being used to retract the bladder so that you cannot tamper with the bladder. So that is the use of this. Just like in sand, we have different types of retractor, but this one is called bladder retractor, used to retract bladder. So now look at this one. This one look like artery forceps, but the difference between artery forceps and this one is that this one have teeth at the tip of it. Look at the teeth. And the name of this instrument is called cocaps. This is called cocaps. This forceps is used during hysterectomy to hold the base of the uterus. That is the operation, surgical operation used to remove the uterus. That is the womb. We will use it to hold the base of the uterus, or we use it to clamp that base when you want to remove the uterus. And again, it is being used to remove dead tissue during dressing. It is used to remove dead tissues during dressing. Another uses of this cocaps is during labor. It is used to rupture membrane. It is used to rupture membrane. I think you can identify it. Look at it. Just look at it. Okay. So now, the next one we have here, this one look like cocaps, but it's not cocaps. You can see the instrument very well. Just look at it. This instrument is called Vorcellum. Vorcellum forceps. Just look at it. Vorcellum forceps. So this instrument is also used to remove fibroid. That is the one function I will still give you. You can also use it to remove dead tissue during dressing, and so other uses of it. So now look at this forceps. I think you know this forceps. This is non-tooth dissecting forceps. Non-tooth dissecting forceps. Just look at it, how it looks like. Non-tooth dissecting forceps. It is used during suturing to hold the tissues together. When you want to suture the space that you make, or the incision that you make use of this thing to hold the tissues together so that you can be able to suture. Alright, we know this thing. Just look at the shape. It's called kidney dish. This one is big one, as you can see. This is the cover. So it is used to pack boys. You can also use it to pack cotton wool. You can also use it to pack some instruments during dressing. Maybe if somebody told you to get instruments for dressing, you can take this. Take the gauze you pack. Then you get some instruments. For dressing purposes. This is what it is being used for. So now this one is a small size, small kidney dish. Alright. So as you can see, this is what is called gallipot. It is used to get, solution like spirits, methylated spirit. You can use to collect solution like Dito during surgical procedure. You can also use it to get solution like hydrogen peroxide. So these are the things that I want you to know. As a nurse, you are supposed to know all these things, names of instruments and the uses. So next time we are going to continue from where we stop. If you like this procedure as we just did, just like, comment and share. Thank you.